ejaculate more, and lower your chances of prostate cancer. Is that really true? I'm Dr. Rena, a urologist and pelvic surgeon. In today's video, I'm going to discuss how the frequency of ejaculation might actually help reduce the risk of prostate cancer. But before we dive into that, let's first understand what the prostate actually does. The prostate is a small gland, about the size of a walnut, located just below the bladder and surrounding the urethra. Its job is to produce prostatic fluid, a substance that nourishes and protects sperm. You can think of it like a small factory that is constantly creating this important fluid. For many men over the age of 40, the prostate often begins to grow larger. This condition is known as benign prostatic hyperplasia, or BPH. It isn't cancer, but it can lead to uncomfortable urinary symptoms such as difficulty starting urination, a weak stream, or waking up multiple times during the night to use the bathroom. Separate from that, however, is the risk of prostate cancer, which becomes more common as men get older. In fact, about 1 in 8 men will develop prostate cancer during their lifetime. And this is where the conversation about ejaculation frequency becomes especially interesting. So why would how often you ejaculate make a difference? Let me explain one possible theory. It's called the prostate stagnation hypothesis. This theory suggests that regular ejaculation may help flush out the prostate gland, almost like clearing out plumbing. It may remove older cellular material, toxins, and inflammatory substances that might otherwise build up over time. Think of it like cleaning a filter regularly, instead of letting dirt and debris pile up. When these substances stay in the prostate tissue for long periods, they may increase inflammation or cause cellular changes that could raise the risk of cancer. There are also studies suggesting that more frequent ejaculation may be linked to slightly higher testosterone levels. And interestingly, men who naturally maintain healthier testosterone levels tend to have a lower risk of prostate cancer. So the big question becomes, how often should you ejaculate to possibly lower your risk of prostate cancer? Before I answer that, I want to point out that ejaculation frequency is only one small part of overall sexual and prostate health. There are many simple lifestyle habits and changes you can make over time that may help you enjoy better intimacy, greater pleasure, and overall better health. Now let's talk about where the numbers come from. A landmark study published in the journal European Urology followed thousands of men for nearly 20 years. The research included more than 30,000 men who reported how often they ejaculated in a 1992 questionnaire, and researchers tracked their health through the year 2010. The findings were fascinating. Men who ejaculated 21 times or more per month showed a lower risk of prostate cancer, compared with men who ejaculated only 4 to 7 times per month. The risk was about 22% lower for men between ages 40 and 49, and about 19% lower for men who were between 20 and 29 when the study began. A more recent study from southern Spain looked into this question further. Researchers studied about 456 men who had recently been diagnosed with prostate cancer and compared them with 427 men who did not have the disease. They asked participants about their average monthly ejaculation frequency during their 20s, 30s, and 40s, as well as during the year before the interview. The researchers grouped the responses into 3 categories: 0 to 3 times per month, 4 times per month, or more than 4 times per month. And here's the interesting part. Men who had prostate cancer reported ejaculating less often in the year before their diagnosis, compared with men who did not have cancer. Let me share some of the numbers, because they're quite surprising. Among the men who had prostate cancer, only about 15% reported ejaculating 4 or more times per month. In comparison, about 26% of the men without prostate cancer reported that frequency. When researchers looked closer, they found that men who ejaculated only 4 times per month had a 64% higher risk of prostate cancer compared with those who ejaculated more than 4 times monthly. Men who ejaculated just 0 to 3 times per month had a 138% higher risk. And men who reported never ejaculating had the highest risk of all, about 271% higher. The connection appeared even stronger in men with more aggressive or advanced prostate cancers. It was also more noticeable in men who experienced moderate urinary symptoms combined with a lower ejaculation frequency. Now, before you start marking your calendar to schedule ejaculation, it's important to remember that this is only one factor in a much bigger picture. Ejaculating more frequently will not magically prevent prostate cancer, and it certainly should not replace regular prostate screenings. You should never ignore the other important parts of your health, things like maintaining a healthy diet, exercising regularly, and keeping up with recommended medical screenings. Ejaculation frequency may be one piece of the puzzle, but it is not the whole solution. If you learned something new from this video, please consider subscribing to the channel. It helps more people discover this content, so they can learn helpful information that may improve both their sexual health and their overall well-being. And as always, remember to take good care of yourself, because you truly deserve it.